Look at the passenger in seat 4B on the flight to Delhi. He doesn't look like a tourist. He's carrying an MRI scan from a clinic in Brampton and enough painkillers to get him through a 10-hour flight. We were raised on a civic myth that said your credit card would never determine your pulse. But in a system where free care is indexed to an 18-month waitlist, the true cost of survival is measured in time. When time runs out in a stagnant economy, health is no longer a right. It's a commodity you have to board a plane to go find. Most Canadians are already absorbing a silent pay cut. Between 2021 and 2023, out-of-pocket healthcare costs for the average household spiked by 11.2%. This chart tracks the rising floor of medical expenses. Non-prescribed medicines shot up nearly 30%, dental services 10%. This represents a new uncovered baseline. Scaled nationally, total household health consumption reached $78.6 billion in a single year. That capital is being siphoned away from mortgage payments and retirement plans. Canadians are liquidating their personal wealth to bypass a public system that is functionally out of stock. The promise of universal care has evolved into a massive, undeclared tax on domestic productivity. The National Foundation is showing signs of fatigue. In the final quarter of 2025, Canada's real gross domestic product contracted by 0.2%. GDP, or gross domestic product, is the total value of all goods and services produced within a country's borders. While the broader economy shrinks, the costs inside the medical system are soaring. Healthcare sector wages grew by 6.9%, significantly outstripping the national average. The institutional response to this divergence is a project called the SNA Modernization. The SNA, or System of National Accounts, is the statistical framework used to measure the health of a national economy. Bureaucrats are shifting the goalposts. They are moving the official success metrics away from hard economic output towards subjective measures like well-being and digitalization. If the data on hospital waitlists and per capita growth is embarrassing, the easiest fix is to change how you define success. They are measuring happiness on paper, while the physical infrastructure of the system decays. It creates a surreal disconnect. The government reports on national well-being, while citizens are liquidating their actual savings to escape the system entirely. The proof of this exit is at the international terminals. In early 2025, Canadian trips to the United States dropped by over 21% as the middle class felt the economic squeeze. But the data contains a massive anomaly. While standard vacations plummeted, travel to highly specific overseas destinations saw a record-breaking surge. Travel to India, a global center for specialized private surgery, skyrocketed by 282.1%. This isn't a fluke in tourism, it's a mass migration of medical capital. The duration of these trips tells the story. The average overseas stay reached 13.2 nights, which is the exact window needed for preoperative consultations and initial surgical recovery. Canadians spent a record $8.1 billion on overseas travel in a single quarter. This is the ultimate arbitrage. We are exporting national wealth to purchase the physical safety that the domestic system can no longer guarantee. Universal care in Canada has fractured into a tiered reality. There is the public waitlist, and there is the offshore market for anyone with the liquidity to move. In this environment, you need a health hedge. It's a dedicated financial defense strategy designed to fund a medical exit before a waitlist becomes life-threatening. Survival now requires hyper-liquidity. You may have to move away from locked-in assets like 5-year GICs. A GIC, or Guaranteed Investment Certificate, is a deposit that earns fixed interest but locks your money away for a specific term. If you need surgery next month, that capital is useless to you. You also need to master the Medical Expense Tax Credit, or METC. The METC is a non-refundable tax credit that lets you reclaim a portion of qualifying medical expenses on your tax return. Every flight and private clinic invoice abroad can be used to claw back the capital the system failed to protect. The Canadian healthcare model has reached a point of effective default, leaving your liquid savings as your only reliable surgeon. But healthcare is just the first signal. The same demographic pressures breaking our hospitals are now converging on the Canada Pension Plan. A parallel crisis will be breaking down in our next investigation.